Life before surgery, at my heaviest, didn't want to go out and do things a whole lot with the family.
It happened without my being aware of it. Before you know it, you're 40, 50, 60, 70 pounds overweight. My doctors were telling me that if I didn't do something, that I would end up getting diabetes.
I've been overweight my whole life. I got pregnant and lost a baby, and a lot of it had to do with my weight. And I wanted to have children.
In this world of bariatric medicine, you're really giving a patient a chance to really change their life forever.
But it is not the cure-all, it is not the fix-all. You have to work at it still.
It's the hardest thing I've ever done. It's hard not to do the same things that you're always used to do because it's just habit, but you have to break those habits to be able to be successful.
To make this successful, you have to follow the doctor and the dietitian's instructions.
Berries are a great choice, and what's great about berries is they're actually much lower in sugar than other fruits.
We care deeply about each patient. We're there with them along the journey, from when they first consider surgery, to having surgery and all the post-op follow-up. And so we're very invested in each patient, rooting for them along the way.
Most people that are especially as overrated as I was, they need to get to the root of why they were that big in the first place.
It's not something to be afraid of, but so we can work with them to craft a plan physically, mentally, spiritually that'll really ensure their long-term success.
So laparoscopic surgery is minimally invasive surgery. You make very small incisions, about 4 or 5 incisions for the weight loss operations. And with that, there's a lot less pain, and patients are able to get up and move around a lot easier.
After surgery, immediately after surgery for the first 2 or 3 days, it was a little bit tough. You don't feel like eating or drinking much, even though you need to. But after a couple of days, life gets back to normal.
2 weeks after I had surgery, I was back at work and fully functioning again. So the recovery was pretty quick, I think.
It seems daunting at first, but it is lifetime goals that we're trying to help the patient achieve.
I got into this because to see the patients come back 6 months after surgery when they've lost weight, they're not taking medication for diabetes or for high blood pressure, or not wearing their sleep apnea mask anymore.
I'm now 6 months out of surgery, and I believe I'm down about 70 pounds.
When I started my journey, I was 411 pounds, and today I am 200 pounds. I have a goal weight of 185, and I want to be able to have children. I want to be able to get on a roller coaster.
We went to go do zip line with my kids 2 years ago for Christmas. And I had to sit down at the bottom of the hill and watch my kids do the zip line and my husband. And one of my goals for myself after surgery was to get to go do that zip line. And just as soon as I hit that 250, I called and I was like, so much happier now, just so much happier that the weight's coming off, that progress is being made, and it's coming off quick.